Okay, angiogenesis, the formation of new blood vessels. I indicated earlier, when we're younger, we have that ability. If there's a problem with an artery, we can form a new blood vessel around the uh, uh, obstructed artery, but we don't do that as we get older. Stimulated by vascular endothelial growth factor, occurs in the embryo as organs develop, occurs in response to factors released by cells that are hypoxic or oxygen starved, most important in cardiac muscle, in response to a chronically constricted or occluded vessel. Veins. Veins collect blood from capillaries and return it to the heart. Compared to arteries, the veins have large diameters, thinner walls, and lower blood pressure. They collect blood from the capillaries and return it to the heart. Compared to arteries, the vein, well, let's see. I already did that, didn't I? I think so. Yep. Let's try this. Okay, venules are called very small veins, collect blood from the capillaries. Medium-sized veins have a thin tunica media and a few smooth muscle cells. The tunica externa contains longitudinal bundles of elastic fibers. Longitudinal bundles of elastic fibers. Keep in mind, with the veins, we want them to distend like balloons. We don't want to hold that outer surface in a strict position. The large veins have all three tunica layers: the thick tunica externa, the thin tunica media. The venous valves, folds of the tunica intima, prevent blood from flowing backwards. They're one-way valves. Compression of the veins pushes blood towards the heart. Compression of the vein pushes blood towards the heart. So if you were to reach in and squeeze a vein because of those one-way valves, the blood would move up towards the heart, but as it tried to come back down, due to gravity, the valves would shut, trapping the blood above the valve. Okay. When the walls of the veins near the valves weaken, varicose veins or hemorrhoids may result. Valves weaken. Here we see a picture of the valves. There's blown up area showing the valves. And we can see that we'll just look at these two here. If the blood is pushed in this direction up, those valves are going to open. And as gravity sets in and that blood tries to come back down, that's going to close those valves shut to make it look like this. Okay, so we have closed valves versus an open valve. Distribution of blood. Heart, arteries, and capillaries have 30-35% of the blood volume. The heart, the arteries, and capillaries. Now, wait a minute. Where's the rest of the blood? The heart, arteries, and capillaries. 30-35% of the blood volume. The venous system has 65-70%. 1/3 of the venous blood is in large venous networks of the liver, bone marrow, and skin. So we have more venous blood in our body than we have arterial blood. Yes, we do. And it's considered to be a reserve amount of blood. Oh, let me bring this back down a bit. Okay. So what we're saying here is the systemic venous system, 64% of the volume. And between that 64%, venules and medium-sized veins have 25%. Large venous network, liver, the bone marrow, and skin, 21%. Large veins take up 18%. Some other numbers here. Pulmonary circuit, the heart, the systemic arterial system. Capacitance of the blood vessel, the ability to stretch. The relationship between blood volume and pressure. Veins are capacitance vessels. Where I indicated the artery, the medium artery, was resistant vessels. The veins, or capacitance vessels, stretch more than the arteries. They act as blood reservoirs. So the systemic veins constrict, venule constriction, in response to blood loss. When that happens, imagine we talked about the percentage of blood that was in the venous system was larger than the amount of blood in the arterial system. So if we venule constrict the veins, what we're in essence doing is we're pushing more of that venous blood over into the arterial side, which increases the amount of blood in the arterial system and in capillaries. Total capillary blood flow equals cardiac output and is determined by pressure and resistance in the cardiovascular system. Pressure and resistance. We'll get into in depth into that. Pressure is generated by the heart to overcome resistance. Absolute pressure is less important than pressure gradient. The pressure gradient is the difference in pressure from one end of the vessel to the other, because we have vessels that are short and vessels that are long. Oops, okay. And then we have flow is proportional to the pressure gradient divided by the resistance. Measuring pressure. We have blood pressure, arterial pressure, millimeters of mercury, capillary hydrostatic pressure. Hydrostatic pressure being the pressure that you'll find within the capillary lumen. And then we have venous pressure, the pressure in the venous system. Circulatory pressure. Must overcome total peripheral resistance. R of the entire cardiovascular system, the resistance. Pressure across the systemic circuit is about 85 millimeters of mercury. The total peripheral resistance is affected by vascular resistance, blood viscosity, and turbulence. Total peripheral resistance is affected by vascular resistance, blood viscosity, and turbulence. Vascular resistance, due to friction between blood and the vessel walls. Depends on the vessel length and the vessel diameter. So length, whether it's short or long, or if the lumen size is small or large, can play a role in the vascular resistance. The adult vessel length is constant. Vessel diameter varies by vasodilation and vasoconstriction. Resistance increases exponentially as the vessel diameter decreases. As the vessel diameter decreases, let's go to here. All right, so what this is saying here, if I can increase the size of that for you. Is it saying that we have a vessel that is this length versus a vessel that is twice that length? In the vessel that's half the length, we have a blood flow equal to 1. With a vessel that is twice that length, we have resistance, which is twice what it was when it was this size. So if the resistance is twice what it was, our blood flow is decreased by half. More blood flow here because we're shorter. Okay, less blood flow here, we have more resistance, and so on and so on. And then when we come down to here, well, what this picture is showing you is that as far as the blood flow, through the center, there is less resistance than around the edges, because the edges create friction of whatever's coming through there as it's rolling along the edges of the lumen inside the vessel. Here we see vessel length, and this is important. This will probably be a test question somewhere. Vessel length resistance increase here. Flow is reduced by half as far as doubling the length. When we come down here and we double the diameter of a vessel, we don't double it, we decrease it by half. Here we've got a diameter of 2 centimeters, and we're going to decrease the diameter to 1 centimeter. The resistance is going to be affected by the following: 16 to 1. So our resistance is 16 times greater when we reduce the capillary or the lumen size of the vessel. And so that's all that chart is showing you. It's giving you the difference between length of the vessel and resistance versus diameter of the vessel with resistance. And here, let's see, we're looking at a thrombus, a plaquing inside of a vessel, creating turbulence. Okay. Overview of the cardiovascular pressures. The vessel luminal diameters can have an effect on cardiovascular pressures, total cross-sectional areas, pressures, velocity, or viscosity of the blood. Okay, what this chart is showing us is vessel luminal diameter. So it's showing us the elastic arteries having the largest diameter, and as we move through the system from the aorta to the large arteries to the medium arteries, which are muscular arteries, to the arterioles, we're basically saying that the lumen size decreases until we get to the capillaries. And then as we get into the venules and going to the veins back to the heart, the size of the vessels increases again on the venous side. Cross-sectional area, what it's making reference to is the elastic arteries versus the muscular arteries versus the arterioles. These are just single arteries. There's not much cross-sectional area. But when we get to the arterioles and the capillaries, we're including many that are working together. So we combine all of them together to get the cross-sectional area. So here we're just singles, moving to a few more until we get to the capillaries, and we have a lot of cross-sectional area. Here we're looking at average blood pressure, and it's saying that the pressure is greatest as we leave the heart in the elastic arteries. It is greatest, and that pressure starts decreasing through the muscular arteries, decreasing further into the arterioles, decreasing further into the capillaries, to the point where the pressure is still decreasing from the venules to the veins to the vena cava, which drops back into the heart. So lots of pressure when we leave the heart, very little pressure when we flowing back into the heart. The velocity of the blood. The velocity of the blood. We see that it's very fast. Centimeters per second. When we leave the heart, the velocity is way up here. And as we move through the muscular arteries to the arterioles to the capillaries, by the time we get to the capillaries, the speed is very reduced. But then we see that as we come through the venules, the veins, and the vena cava, that speed is increased again. How are we increasing the speed of the venous blood when we went from a system of very little velocity, and now we're going to a larger lumen size, but yet our velocity is increasing. We don't have the smooth muscle, thick walls that we had in the arteries pushing that stuff up. One hint that we saw was that we had one-way valves in the venous system, but we'll keep that in mind as we move on here. Let's see where we're at for time. Okay. Arterial blood pressure. Systolic pressure is the peak arterial pressure during ventricular systole. Diastolic pressure, the minimum arterial pressure at the end of ventricular diastole. Pulse pressure. These are things that you need to do your best to remember. Pulse pressure, the difference between systolic and diastolic pressure. Mean arterial pressure, or MAP, is the diastolic pressure plus 1/3 or 1/3 plus pressure. Pressure and resistance. Normal blood pressure is 120/80. Hypertension. Abnormally high blood pressure greater than 140/90. Hypotension, abnormally low blood pressure. And let's say somebody comes into your office, or you take somebody's blood pressure and you notice that their blood pressure is low. Is this necessarily a problem? No, it's not. But you need to ask questions. If a person is an athlete, typically an athlete will show a lower blood pressure than somebody who's not. So ask questions to that's what your chief complaints about in your history. You need to know what's going on. Elastic rebound. We kind of hit on this a little bit. Elastic rebound, the arterial walls stretch during systole, which is the contraction, and they rebound or recoil to the original shape during diastole, which keeps moving blood through the system. So even though we're through with the contraction, The fact that the vessels are going to rebound or recoil to the original shape, it's going to keep the pressure moving, or the fluids moving through the vessels. Pressure and resistant. Pressures in the muscular arteries and arterioles. The MAP and the mean arterial pressure and the pulse pressure decrease with distance from the heart. Mean arterial pressure declines as arterial branches become smaller and more numerous. Pulse pressure decreases due to elastic rebound in the arteries. Okay, here we have a graph. Bottom side, we're seeing the aorta moving down to the capillaries and to the venules up to the vena cava, and we're saying that the systolic contractions, pulse pressure is somewhat mirroring to a certain degree the mean arterial or MAP pressure. And then they match up. Venous pressure determines the amount of blood arriving at the right atrium each minute, which is venous return. Low effective pressure and low resistance in the venous system. How are we getting it back to the heart? Return of the blood to the heart is assisted by the skeletal muscular compression of the veins. When we contract skeletal muscle, we saw that they had one-way valves, and when there's compression, that's what's squeezing the veins to push the blood against gravity through the body. When the leg muscles are immobilized, blood supply to the brain is reduced and fainting may result. But I want you to think about, let's say we're in a wheelchair and we can't move. We're quadriplegic. There's no movement. We're not able to contract the musculature of the body to aid to get the blood back to the heart, the venous blood back to the heart. But yet it's still managing to get there without the assistance that we see provided with the arteries. A lack of pressure, lack of smooth muscle contractions, etc., etc. Well, we have what's called the respiratory pump. The thoracic cavity expands during inhalation, decreasing venous pressure in the chest. So we have a negative pressure system based on the diaphragm contracting. So the diaphragm contracts, pulls the air into the lungs, moves air out of the lungs, but that pumping mechanism in the abdominal pelvic region is also a system that's like a hydraulic pump, pulling fluids into a pump versus pushing the fluids out of a pump. So that's helping also to get the fluids back to the heart. Capillary exchange, vital to homeostasis. Materials move across the capillary walls by diffusion, filtration, and reabsorption. I'll get there. Diffusion, movement of ions or molecules from high concentration to lower concentration along a concentration gradient. That's diffusion. Diffusion routes. Water ions and small molecules diffuse between endothelial cells or through pores. Some ions diffuse through channels in plasma membranes. Large water-soluble compounds pass through fenestrated capillaries. Lipids and lipid-soluble materials such as O2 diffuse through endothelial plasma membranes. Plasma proteins cross endothelial of the sinusoids. So basically what's happening here is we're moving from smallest diffusion to things that are larger and larger and larger, and talking about how they diffuse. It's different as we become larger, or the ions or whatever it is that we're trying to diffuse becomes larger. Filtration. Driven by hydrostatic pressure, water and small solutes forced through the capillary wall leaves larger solutes in the bloodstream.